living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
An estimated 37 million Americans suffer from chronic kidney disease, or CKD. That's about 1 in 7 adults. Even more troubling, as many as 9 in 10 of those adults do not even know that they have it. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Jacob Churchill, and today we're talking about chronic kidney disease, what it is and why it is so serious. Stay tuned. Welcome back to Healthy Living for Life. Joining us today is Dr. Robert LeClaire, a nephrologist at St. Peter's Health here in Helena, Montana. Thanks for coming on the show with us, Dr. LeClaire. We really appreciate your time.
Welcome, Jacob.
Now, before we get into chronic kidney disease itself, can you tell us what makes a disease chronic in the first place?
That's a good question. Something that's going to last more than a few months is usually what we think about with chronic, in the sense of chronic kidney disease. It's more of a separation to acute kidney disease, which can occur, and in those cases, often the kidneys can recover essentially completely. So it's more of a comparison to acute versus chronic from a medical standpoint. But most people with chronic kidney disease have some degree of decreased kidney function, scarring, I guess you could say, potentially is a cause, and it's lifelong, or as long as they've had it.
Okay. And for those of us that aren't sure about the function of our kidneys, can you tell us a little bit about what the kidneys do for us?
For an organ that we really don't know about or feel, they do amazing amount of things for us. They obviously get rid of excess fluid. That gives us your urine. Get rid of electrolytes, salts, things like potassium, sodium, excess phosphorus, magnesium. They also are involved with our blood count, so they actually tell the bone marrow how much blood that needs to be made, and they are involved with bone metabolism. So how our bones work is also intimately involved with our kidneys. So they do quite a bit. We just don't feel it.
Wow, yeah, that's quite incredible. I never would have guessed that the kidneys were responsible for that much. Now that we know a little bit more about what our kidneys do for us, let's dive into the chronic kidney disease. Do we know what causes CKD?
CKD is simply stating that the kidney function isn't, I guess one way to think about it is the kidney function isn't normal for an extended period of time. And there are a myriad of things that can cause you to have abnormal kidney function. So it's a question that can't be really answered for CKD for just the general population. There's just so many different reasons why someone has potentially a reduced function of their kidneys. Something as simple as they only have one kidney, to they have diabetes that has caused kidney damage and have a progressive loss of kidney function and may end up with kidney failure. So the variety is that's not the right word to use. It's a myriad of things that can cause kidney disease. Sure. And that's my job, is to try to figure out why someone has kidney disease.
Okay. Now, nearly 1 in 3 people with diabetes also has kidney disease, making it actually the leading cause of CKD, as I understand it. Could you help us understand the connection there?
So diabetes, poorly controlled diabetes particularly, over time causes damage to our smallest vessels called capillaries. And there are a number of organs that are in our body that are affected by this capillary injury. You may have heard of people having problems with their vision because of diabetes. People have loss of sensation because of damage to their nerves. And the same thing is happening to the kidneys. So the kidneys are a giant, you can think of them like a giant capillary bed. And that's how they function. And diabetes, unfortunately, has a significant impact on them over many years, and causes this chronic process that eventually can cause the kidneys to fail.
I see. Are there any other health conditions that might put someone at risk of developing kidney disease?
Again, because there's a myriad of reasons why someone has kidney disease. There's a myriad of causes, but the most common is diabetes by far. And secondly, probably is hypertension that's been poorly controlled. There's genetic causes like polycystic kidney disease, but individuals who have that usually know that they have polycystic kidney disease. So beyond that, the list is long.
Okay.
But the big ones are diabetes and hypertension.
All right. Is it true that early stages of CKD might not present any symptoms, and why is that?
So actually, it's more severe than that. I've had people come in with late-stage kidney disease and have no symptoms.
Really?
So you can have, some people have less than 10% kidney function. Sometimes some people have less than 5% kidney function. And if they're otherwise healthy, they may not have any symptoms. That's uncommon, but it does happen. And like I tell most of the patients that I first meet, this is that the great thing about kidney disease is you don't feel it. The bad thing about kidney disease is you don't feel it. So most people don't come to me to my office because they're having symptoms. They come to my office because their doctor tells them that there's something wrong with their kidneys and they need to see me. So it's you can live with pretty bad kidney function without requiring dialysis.
Wow, okay. That's great to know. We're getting close to a break here, but I think we might have time for another quick question. For those that do present symptoms for advanced kidney disease, what do some of those symptoms look like?
Well, these are very advanced. So this is when the clearance of your blood is usually less than 20% normal. And usually it's even worse than that. But the symptoms are called uremia. It's not a well-used word that most people will know about, but uremia is the idea of symptoms from kidney failure. People can have loss of appetite. They have changes in their sleep cycle. They have itching that can be just diffuse and very, very problematic. They can have a metallic taste in their mouth. Nausea, especially in the morning, can occur. But it's pretty amazing how different and how symptomatic some people are, and other people have no symptoms at all.
Wow, very interesting. Thank you very much, Dr. LeClaire. We actually need to take a break, but coming up next, a healthy diet is important for all of us, but especially for those living with chronic kidney disease. We'll be right back to learn how you can control your CKD so that it doesn't control you. Welcome back. Still with us is Dr. Robert LeClaire from St. Peter's Health. Thanks again for staying with us, Dr. LeClaire. We really appreciate your time today. Can CKD be healed over time, or is this a permanent condition?
If you're thinking of CKD, if you're thinking of someone who has CKD is because of scarring, which is most of them, it's a permanent condition, but it depends. Some people have other organ involvement. For example, maybe they have heart failure that's leading to the kidneys not working as appropriately as they should. If that's corrected, sometimes their CKD is quote unquote improved or resolved. But it's for the most part, most people who have CKD, it's a relatively permanent condition.
Okay, for those who are living with this as essentially a permanent condition, is dialysis always required, or is that something that could potentially be avoided?
Well, thankfully, it is not something that can't be avoided. There's about 50 in Helena, our catchment area for dialysis, around 70,000 people. We have 45 to 50 patients on dialysis at any one time. There's probably around 60 to 70 transplant patients in the Helena area. So that's 110 patients, and there are thousands of people with chronic kidney disease. There would not be just one nephrologist in Helena. The entire hospital would be filled with dialysis patients. Yeah, I can't even imagine what it would be like. So, no, very few people end up with renal failure.
Well, that's good
that
news.
Requires dialysis.
While we're talking about renal failure, can you tell us about end-stage renal disease? And what is it? And is that condition unavoidable for those living with chronic kidney disease?
Well, just end-stage renal disease basically implies that you're going on dialysis or you're getting a transplant because your kidneys have failed enough that you are now ill from the kidney disease. You may still be making urine, most people still do, but it's just not clearing the blood adequately enough, and these people need to be on therapy for that. Or have decided not to do dialysis and have gone on more of a comfort care sort of approach. That is really uncommon. Like I said, it's we probably have, I don't know, 5 to no more than 10 people start dialysis in our community a year. Some people get a preemptive transplant, but most people, fortunately, never have symptomatic, clinically apparent to them kidney failure.
Wow, well, that's good to hear, especially some of those low numbers about new dialysis patients. I'm happy to hear that that's not a larger percentage of the population.
So am I.
Shifting gears for a second, why is diet so important for those living with CKD?
Well, it depends on the degree of CKD. So because the kidneys are so important in getting rid of water, salts, you could be impacted by retaining some of those things, and that could have a detriment on your health. The most important one, and this is less dependent on how severe a degree of your kidney function is really salt. So one of the biggest things that I educate folks on and work with them about is salt intake. In the earlier stages of CKD, that's going to help with their blood pressure. And then later stages of CKD is reduce the amount of fluid that they may build up because their kidneys aren't getting rid of that excess salt water. As far as diet is concerned, it's really on an individual basis because so many people have different reasons for kidney disease and have different levels of kidney dysfunction. And so that's going to really determine what kind of diet they need to be on.
Okay. I've also heard that that not eating enough could potentially make those issues with kidney disease worse. Is that true?
No, not really. I mean, I've seen extremes of that. When we usually talk about not eating enough, we're usually talking about people who are getting close to needing dialysis or are on dialysis. And sometimes they have nutritional deficits because of the effects of having kidney failure. Unfortunately, dialysis cleans your blood to the degree of probably 15% of what would be considered normal kidney function. And so you're still having, even if you may not feel it, you're still having the effects of the uremia, the toxins. And so sometimes people don't eat as well because of that. So that's when we really are talking about not eating enough.
I see. And you mentioned that people should be limiting possibly fluids and salt and other things in their diet if they have chronic kidney disease. I've also heard potassium, phosphorus, and protein are some things that should also be watched closely. Aren't all of those things good for us, though?
So a high potassium, low salt diet is actually excellent. If our general population did that, there'd be a lot less people on dialysis and a lot less people with hypertension. And yeah, no, it's very good. But the problem is that if you have significant kidney dysfunction, you're on certain medications that are trying to help protect your kidneys from the progression of kidney disease. You also have kidneys that don't work very well, and these all can lead to retention of potassium. Now, I have people who have very severe kidney disease, sometimes on dialysis, and they require getting potassium, and we have to give them potassium. But the vast majority of people who get to that point or significant kidney disease will have issues sometimes with potassium, and I'll have to make sure they're on a low potassium diet. Phosphorus is also cleared by the kidneys, and it depends on what their phosphorus is and what their bone metabolism is doing. So again, it's all the dietary aspects of chronic kidney disease have to be tailored, and they often aren't, unfortunately. They have to be really tailored to the person and their condition and what's going on with them. I've seen patients come to my clinic who are on a renal diet, and for a lot of what they need, they don't need to be on a renal diet. It's not helpful. So you really have to talk to your doctor, you have to talk to your dietitian, and it has to be tailored to your condition and your needs.
All right. Well, unfortunately, we're out of time in this segment, so we're going to have to pause for another break. But when we come back, we're going to talk about the importance of exercise and some helpful tips for monitoring your chronic kidney disease. Be sure to stay with us. All right, welcome back to Healthy Living for Life. We are still here with Dr. Robert LeClaire, a nephrologist here at St. Peter's Health in Helena, Montana. Thanks again for joining us today, Dr. LeClaire. We'll just jump right into it. How can pain relievers like ibuprofen cause damage to our kidneys?
This is an interesting one. They can interact with some of the medications that people take for treatment of hypertension and some degrees of some issues with medications taken for kidney disease. So they can do things like worsen your blood pressure, affect fluid issues. So sometimes people can retain fluids on ibuprofen or other nonsteroidals. Sometimes they can have a direct impact on the kidneys. What I would say is you should talk to your doctor if you're taking over-the-counter pain medications and determine if they are okay at the doses you're taking. I always emphasize moderation in anything, and that goes the same with pain medications. There are people who have chronic kidney disease of some degree who take nonsteroidals every day and are okay, but it's just, you really have to talk to your physician about it. And again, I wouldn't say that you can't be on them, but don't take them without discussing with your physician.
That makes a lot of sense. What about some other common drugs that might have adverse reactions to those living with CKD?
The drugs that are used for antiviral therapy, for example, for fighting off the flu, are often cleared completely by the kidneys. And so sometimes people become symptomatic from these. They can be quite sedated. So it's important to tell your physician if you are going to be put on one of those medications. Also, some medications that are used for neurologic pain, neuropathic pain, also are cleared by the kidneys, and you can have significant sedation from them. So discussing that with your physician if you're put on one of those medications is important.
Okay. And shifting gears again now, how does physical activity and exercise help those with CKD?
It's going to just help them be more healthy. So one of the issues with people who have significant kidney disease is that you need to understand that for most of them are diabetic, because that's most of the people who end up with renal failure and have kidney disease. They're often, many of them are not very healthy, and it's because of the effects of the diabetes on their body. And so they're also much older, 60, 70 years old. And being physically active is critically important for all of us, but especially for them. And does it help the kidneys per se? No, but that's not really the important thing. It's that they have a reasonable functional status despite their chronic illness, which is a disease state that's actually not just affecting their kidneys, but affecting their entire body.
Okay. Is it true that those who are overweight or obese have a harder time managing their chronic kidney disease?
Not necessarily, but the problem I have with folks who are obese is, again, it's going to be harder to control their diabetes. It's harder for them to be physically active. And if they unfortunately are going on dialysis because their kidneys have failed, transplant centers do not do transplants in people with BMIs typically over 37. And so one of the frustrations that I have as a nephrologist is for someone who's otherwise doing okay on dialysis, may not get a transplant for the rest of their life, and they may be on dialysis for 10 years just because of their weight. So from my perspective, that's when I really am concerned about folks who are morbidly obese and may need to be on dialysis. So one of the first things I talk about to people who I'm worried may progress over the next 3 to 5 years to end-stage renal disease is that you really got to lose the weight, because I want you to get transplanted and not be on dialysis.
Okay, that's great information. How does a person determine if they are at risk of or have kidney disease?
A blood test.
A blood test. That easy. Just go in and get it blood tested?
Yeah, it's as complex as my field is, can be, just trying to figure out why people have kidney disease and how to deal with it. A lot of what I do is based on blood tests, is chemistries and urine tests.
All right. I think we might have time for just one more question here. If I had CKD, how would I be able to tell if I was doing a good job at managing that?
Your blood pressure would be well controlled. You want to have your blood pressure, and the goal now is less than 130/80 for all folks, or most. And your labs show that your kidney function is remaining relatively stable. And most importantly, is that you are not spilling any or very little albumin or protein in your urine. And that's actually one of the most important things that we watch, because people who spill a lot of protein or albumin in their urine often are the ones who may have are at higher risk for progressive kidney loss.
Great information. Thank you so much for your time today, Dr. LeClaire. Unfortunately, that's all the time that we have for today. And thank you for watching. We hope that you'll come back to join us next week. But until then, please stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.